hundreds of millions of Americans have already received the COVID-19 vaccine, and now the focus is shifting toward the younger population as young adults are now eligible, and many parents are pondering if they will get their own kids vaccinated when the opportunity presents itself. Experts at Sierra Health are helping families understand the importance of the vaccine and how it may affect children. Here to shed more light on kids and the COVID-19 vaccine is Medical Director of Health Education and Wellness, Dr. Ilan Shapiro. Thanks for joining us this morning.
It's a pleasure to be with you.
So many parents, including myself, are asking ourselves, why should I vaccinate my child if cases are low and children aren't severely impacted by COVID?
It's extremely important to know that I'm coming here as a pediatrician, but also as a father. At the beginning, we there was this feeling that COVID-19 was just a flu for our kids, but in reality, it's not. It has been, and right now we're seeing more kids being affected as the same way as adults with long COVID, meaning that they have chronic disease, headaches, heart problems, and other stuff that we have not seen. And of course, we have heard a lot about MIS-C. It's true that thanks God, we have not had any mortality rates as bad as adults, but we still need to continue checking and protecting them.
And we know that youth ages 12 to 15, they're eligible to receive it if they want. Is it safe for them?
It's a great question. Right now, for example, with COVID-19, the disease, it actually creates a lot of headaches. And right now, what we're seeing with specifically with Pfizer vaccine, we're seeing just a little bit of pain on some redness, fever, very, very aligned with what we're seeing with adults. Then practically, I'm looking forward to vaccinate my kids.
Okay. And a lot of people think, okay, these vaccines, it's still new. How thoroughly were they tested in that 12 to 15 age group?
The good news is that the technology that we're using has been actually developed in decades. We started actually using it at the early 2000s, and right now with the information that we have in adults, and right now being translated in kids, has been very, very safe. To the point that we are seeing that most of the kids on the Pfizer research and also with the Moderna research were actually very well protected against COVID-19. Then we're seeing only the good stuff, and we are seeing only the mild redness, soreness that we're seeing in adults.
Is there somewhere that the public can go to see these studies and some of the results and the stats from the tests?
Of course, we have a lot of information at vaccinateall58.com. Also, the CDC website has an amazing array of information. And of course, we have the American Academy of Pediatrics website where parents actually can go there. It's healthychildren.org. And there we are trying to make sure that we create the conversation, making sure that everybody, it's okay to be afraid. We want to protect our kids, but we need to have the information that it's evidence-based to make sure that we are doing the best choice for our children.
Let's talk about the dosage. Is it the same what they're giving young adults as what they're giving adults?
It's a great question. At this moment, we are seeing that it's the same dose for Pfizer, and we're seeing the same dose on the research part of it with Moderna. We need to adjust the dose probably with smaller kids or actually increase it because we, as adults, some of the vaccines that we use are different doses than the kids. Could be a little bit more, could be a little bit less, and that's what actually we're measuring right now.
What about the efficacy? Is it the same in adults as in our young people?
Oh, yes. It has been actually, with Pfizer, it's above 90%, meaning that kids are very safe. And the important thing is that we have seen also reduction of transmission of the virus. A lot of the times we have seen the kids being the reservoir, like the influenza, that they have actually the virus and they can transmit it to other people. And with this, we have seen actually the virus go down. Then it's really good news for all of us.
And can you explain a little bit more about how these mRNA vaccines work? I mean, are they going to alter a teen's DNA?
I have heard that, and I have really good pediatrics. No changing anything right now. The way that it works is practically showing our cells how to create antibodies, and the antibodies are practically neutralizing and marking the virus. And that way, whenever we see the virus, it will be attached to it, and our body will destroy it. And that's the way that it works.
Dr. Shapiro, anything else you want to tell our audience about the vaccine, especially when it comes to our kids?
It's an important moment to actually have a conversation with our kids and our families. It's okay to be afraid. It's okay to have doubts, but it's very important for us as parents to make sure that we are getting the resources that we need. And most importantly, we need to start vaccinating our communities against fear with a dose of truth. This way, we can actually start closing the gaps for so many months of suffering. And most importantly, I hope that by December, we are having a beautiful dinners with the family. We're having filling stadiums the way that we used to, and everything as we have seen it can be used. And the tool that we have right now is the vaccines. Then have the conversation, and we're always here to help you.
All right, Dr. Shapiro, some great information. A lot of questions out there, and you gave us some of the answers, so we appreciate it. For more information about the COVID-19 vaccine, you can visit vaccinateall58.com.